Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, answering the question of the week. Dr. Pane, this question comes from our YouTube channel. A person from, looks like the East Coast here, has a question about a breast implant repair with some follow-up surgery questions. Dr. Pane, would you like to comment on this and follow up?
Yes, as I understand it, the person has an implant in place and believes the implant's making them sick, and there's a cyst behind the nipple and some other issues. Whatever it was evaluated. It wasn't considered to be like an insurance type situation to fix, and they want to see what's going on. The short answer is we don't have 100% of the information we would need to know what's happening here. The little bit longer answer, and I'll speculate in a couple of directions. If it's a silicone gel implant, maybe it's leaking, and there's some concern that some health issues are related to that implant. What we'll say is that essentially the science behind that is not very good. In other words, having studied it, silicone gel implants are not implicated in these other health issues that may coincidentally happen after you have the implants placed or even after the implants are ruptured. That being said, not everyone accepts that in as their own explanation. So we are happy to remove implants from people that feel that they are an issue for their health. I do provide that service. When you do that, you also have to address the breast tissue, depending on how stretched out it's been from having the implant in place. There's a lot of variables here, and it's hard to make a complete blanket answer. Technically speaking, you don't have to address that tissue. Some people want the implants out, even if it leaves them with some loose, leftover, essentially skin envelopes. But in most cases, we will do something to address that at the time of the surgery. The issue with the cyst or something going on behind the nipple, again, we need to know the age, has this been imaged, what kind of lesion is it, and all of that before we would get settled on a full treatment plan. But I would say that it sounds to me like an implant removal, maybe not a replacement, probably not a replacement, often a mastopexy to reshape the breast tissue, and then the question of something behind the nipple. If there is a lesion that is concerning to anyone in terms of your primary care or anyone that did imaging on it, that would be addressed first. We don't usually handle a potentially problematic breast lesion at the time of what we consider here cosmetic procedures. But if that is cleared and felt to be benign, even if it isn't biopsied, if it looks benign enough on the imaging, then you could take that, undertake that all at the same time. I don't usually specifically remove lesions if it's going to take me away from the main operation we're doing, but it may be part of the tissue that gets removed when we do the breast surgery. So again, this is a little bit complicated. It really needs an in-person exam and more detailed information to go over all the different parameters of what we could be talking about here, because it can go off in different directions. But that's a big overview of what the kind of possibilities are in this case. So I hope that helps to allay your fears and answer some questions there. We would need more information, and so would any doctors in your area if you go to them with this same kind of issue. But hopefully you will get the care that you're looking for and things work out well for you.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our YouTube channel, website, Facebook page, Instagram, or Twitter. And Dr. Pane, we appreciate your time, and we'll see you on the next question.